going to talk about is the importance of documentation and compliance and how they tie together, and basically the best way to stay within the law. All right? Want to make sure we're doing things the right way and not getting ourselves into any trouble at all. Compliance is very important, but ICD-10 and compliance integrate, and they come together to make sure that we're presenting the best picture of our patient. So obviously, we need to be compliant. That's the rules under which we live. About 65% of all the payments to medical providers, EMS providers, come from taxpayer dollars. Roughly 50% is Medicare, roughly another 15% is Medicaid, and you folks are going to have a lot of fun because you got managed Medicaid barreling towards you. You have it already here somewhat, but now it's even barreling towards you even more. So in the Post-Affordable Care Act world, even though you're a state that did not go through the exchange process, there are still many more people who are covered by Medicaid than there ever were before. And that means much more scrutiny over what we're doing. So we have to do things the right way. We need to know clinical. That is what's really going to drive the train, the patient's clinical condition. Because ICD-10 is coming. Let me tell you what ICD stands for. International Classification of Diseases. And up until this point in time, we have worked with ICD version number 9, which came out in the 70s. Nothing has changed since the 70s. The trouble is, the world has changed significantly since the 70s. And one example that I give, in the only 13,000 codes that were used for ICD-9 for all of healthcare is my son. My son, my 30-year-old son, has a rare kidney disease called Berger's disease. It's kind of a crummy experience because it came from a flu or a respiratory infection. Got an stray infection, ends up with this kidney disease called Berger's disease, and now he's in complete kidney failure. He has a disease that was not classified as its own disease till sometime in the 80s. So under ICD-9 coding, there's no way to describe what he needs or what's going on with him. This isn't a payment matter. This is a get services, get medications, and things that he needs. And he's not the only one with Berger's disease. When he needs a treatment or he needs a drug that's related to his disease, we jump through all these hoops because there's no way to classify what's going on. There's a very limited list of what's going on to describe our patients. And every single claim that gets submitted for payment has to describe the medical issues that are going on with the patient. There is no way now under ICD-9 to describe the right from the left. Yet it makes a significant difference what's going on in the body, if it's the upper quadrant or the lower quadrant. ICD-10 graduates us from 13,000 ways to describe things to 68,000 different ways to describe things. On top of that 68,000, there's another 72,000 that hospitals and doctors will use for procedures. So it is a big leap. And what's very interesting is 38 countries in the world use this way to describe what's going on. The idea is to make us all compatible, to make us that we can gather data and understand how we can better serve patients, communities, public health and safety. 37 countries have put in ICD-10. One country has not. God bless America. We do not have the same healthcare system as everybody else in the world. We have a multi-layered, complicated healthcare system. And so it took us a long time to get ready for ICD-10. And Congress first wanted us in on 2013. They gave us a reprieve till 2014. After 2014, all bets are off. We have a drop-dead date of October 1st, 2015, which means every claim, every date of service from October 1st, 2015 will have to have these codes on it to describe what happened with your patient. Every single claim from October 1st, 2015 forward. Up to October 1st, we use the old ones that we have 13,000 on. Now, for anybody who does billing, most of you will have this built into your system. If you use Zoll, if you use TriTech, if you use AIM, if you use MetaPoint, any of those systems will have the codes built in there. Yes, you're going to have to learn to navigate the codes. I'm not undermining that it's going to be a challenge. But the real issue is, unless you have information from the field providers about the mechanism of injury, the where, the how, and the what happened to your patient, you are going to be, and let me use a technical term here, screwed. Royally. Because you won't have the information you need. So this is going to be on the field providers. But fortunately, it really is about the patient's clinical issues. And this does impact every single field provider. So it's finally designed for every doctor, every radiologist, every nurse, every EMS provider to describe more about the patients. It's not as much about the billing issue as the clinical issue. And finally, it plays to what you do best, which is patient care. So it will be used, it will be gathered by all of the statistical gathering people in the world, because this is information that will be shared internationally. It will create a compatibility electronically about what we all do in healthcare, and we can finally make an impact on some public health and safety issues that we couldn't do before. So let's do this from the perspective of compliance, and then I'm going to take you to the ICD-10 and show you how it ties together.